Asante mantemu apomden adwumefo ahyiam e Lancaster Hotel Kumasi e nanu ahyiamu e na mpanimfo eye omudi bu nkompo ahwe wondwumadie afi atwamu de ekoyie de ankoyie eno e na ama mpanimfo nyina behyiamu a omubesesa adwene na omawu kwampo befa so a yekoye neman womba yire apomden semu ama omanfo enyina Opemsuo TV suni Opemsuo radio ni midin ade kwame ado jamfe kumani dwumadie no de akwaso nyina yebama mo ahwe na motie mu nsem medamo ase
to deliver my message this morning. It's my honor and privilege, and on behalf of the Regional Health Advisory Committee, to welcome you to this annual performance review of the Ashanti Regional Health Directorate. This gathering is more than a procedural exercise. It's a moment of honest reflection, collective accountability, and renewed commitment to the health and well-being of the people of the Ashanti region. Over the past year, our health workers from the regional hospitals to the remote community health posts have continued to serve with dedication, often under difficult conditions. This review is in part a tribute to their efforts and a platform to examine how well our systems, resources, and strategies have supported them. There are areas of particular concern that must anchor our discussions today. First and foremost, as has been highlighted by our director, maternal mortality. The reduction of maternal and neonatal mortality remains one of our most urgent priorities. While we have recorded some commendable gains in skilled delivery and antenatal care attendance, we know that far too many women in our region still face unacceptable risk during pregnancy and childbirth. We must interrogate the data before us honestly, examining the gaps in emergency obstetric care, referral systems, and community-level interventions, and commit to targeted actions that will save lives. With the NHIS coverage, the National Health Insurance Scheme remains the single most important vehicle for ensuring that no resident in the Ashanti region is denied the care on account of inability to pay. Yet coverage gaps persist, particularly among the poor, the rural, and the informal sector workforce. We must ask ourselves, are our enrollment drives reaching those who need the protection the most? Are claims being processed in ways that keep facilities motivated to serve the insured clients? These are questions this review must help us to answer. With infrastructure, we believe that quality care cannot be delivered in crumpled and inadequate facilities. Across our region, several health posts, district hospitals, and CHIP compounds are in need of rehabilitation, expansion, and basic equipment. We must assess honestly where the infrastructure deficits are directly compromising the quality of care, and advocate forcefully for investment needed to bridge those gaps. As a committee, we believe that performance reviews of this nature are most valuable when they are candid. We must celebrate genuine progress, confront our shortfalls without defensiveness, and draw lessons that shapen and sharpen our plans going forward. I encourage all participants to engage fully your insights from the front lines of the service delivery, which are indispensable to sound decision-making at the regional level. With that, I look forward to a very productive and fruitful session today. May God bless us all, and may God bless our homeland Ghana and make our nation great and strong once again. Thank you.
Permit me to sign resistance protocols. I think I'll just call to give this direct message. I think my time is not yet, but I'm happy to address you. I'm very happy to be in your midst. When I entered the hall and I saw the dignitaries and my former bosses, and I realized that my good friend, I call him Twinny, has done it again. Let's give him a clap. He's done it very well. I think that the team is quite apt in terms of free primary health care. Where I sit, that is what we eat morning and day, free primary health care, work on the guidelines and all that. So as I read it in terms of using it to accelerate universal health coverage and bridging the gaps, I was very happy. And I've taken a lot of notes in terms of what Fred wants to see in terms of data, what our chairman said, Nana, my father. And Nana look and laugh. You know, there's a reason why, but Nana, before the next chairman, that will be sorted out. And so I'm very happy. I'll also stay true and contribute. In fact, I started from this place, Ashanti region, as a district director. So when I come here, I really feel at home. So BB will go with you on behalf of the Director General to ensure we take the notes and ensure that this free primary care we're doing with all the 42 districts, we get it right for the country and give our people the best of care. Thank you very much.
So, I need to state that this statement is not a solidarity message per se. It's a statement from the DG. So, Nana Chair, the regional director, let me stand on the existing protocols. So, I think the BB said he was here as a regional, as a district director. I was here several years ago as a district director and also at the region. So, and also live here. So this is my home.
You're welcome.
Thank you. So I'm pleased to extend warm solidarity greetings to all of you gathered here. This annual performance review meeting is an important tradition within our service. It provides us with the opportunity to reflect honestly on our performance, examine lessons learned, and reaffirm our shared commitment to continuous improvement and accountability to the people of Ghana. I wish first and foremost to express my deepest appreciation to all staff in the region for your dedication, resilience, and unwavering commitment to duty. Despite systemic operational gaps, constrained resources, and often challenging working environment, you all have continued to deliver essential health services to your communities with professionalism and sacrifice. I also wish to acknowledge and thank our medical directors, district directors, medical superintendents, physician assistants, committee of nurses, midwives, and all those who carry the daily responsibility of leading service delivery at the facility, at the district, sub-district, and community levels. Your leadership ensures that policies are translated into care and that services reach the people who depend on us the most. I want to extend special appreciation to you, the Regional Director of Health Services, as you represent the Office of the Director General in this region and serve as a critical link between the national policy direction and frontline implementation. Your stewardship and leadership remain indispensable to the success of our service. Colleagues, maybe as the actor said, and senior colleagues, the performance indicators from the past year at the national level demonstrate encouraging progress. Improvements recorded across several levels of the service delivery indicators reflect the hard work and commitment of staff throughout the country. However, we must also confront areas where progress remains insufficient. We must intensify efforts to reverse the deteriorating trends observed in 1. Institutional maternal mortality, skilled delivery coverage, mortalities related to non-communicable diseases, family planning, acceptance rates, and pentatonic coverage, among others. These indicators represent real lives and family realities, and they demand renewed focus, innovation, and strengthened supervision at all levels of care. Our reviews must therefore be honest, evidence-driven, and solution-oriented. To ensure effective operations this year, I'm asking all regional directors, so this is from the DG, to assert their leadership roles with confidence and my full backing in the following. 1, maintain discipline within your regions. Safeguard the financial health of your facilities. Ensure consistent availability of medicines, consumables, and essential logistics. Internally generated funds must be managed responsibly with deliberate ring fencing for maintenance and operational sustainability. Keep close watch on underperforming districts and facilities. Intensify supportive supervision and remain visible on the ground through regular monitoring and engagement visits. I urge all to strengthen patient grievance redress mechanisms and implement practical measures to promote client satisfaction, support patients living with disabilities, and foster community relations. By addressing these concerns proactively, we can avoid unnecessary public controversies and maintain public trust in our facilities. As we look ahead, government will soon launch the free primary health care policy, a major initiative aimed at removing financial barriers at the entry points of our health system. This policy will cover existing primary health care service while prioritizing population-based interventions, including screening for non-communicable diseases, health education and promotion, community sensitization, and mobilization services. We will soon embark on rapid staff orientation and training nationwide, up to the chief's zone level. I will count on your full cooperation to ensure smooth and timely rollout of this very important national policy. Finally, let me reassure the regional director and your team that with strong support from the Ghana Health Service Council, we continue to engage the Ministry of Health and other relevant stakeholders to address systemic service delivery challenges, including staff constraints, funding limitations, infrastructure deficits, and equipment gaps. We remain committed to creating an enabling environment that allows you to perform your duties effectively. On behalf of the headquarters and the Ghana Health Service Council, I wish the region a fruitful and productive deliberation during this 2025 annual performance review. Let us continue to serve with integrity, lead with purpose, and work together to improve the health and well-being of every Ghanaian. Thank you for your dedication, and I wish you a successful meeting. Thank you.
Honorable Regional Minister, Chief of Ashanti Communities, Regional Director of the Ghana Health Service, distinguished partners, ladies and gentlemen, good morning. It is a great pleasure to join you here in the Ashanti region for this regional launching ceremony of the NOP project. The Korean government is funding $13 million for this project. Just last week, we officially launched this project at the national level. Today's event is particularly meaningful as we bring the project closer to the regions and communities where health services are delivered every day. Ashanti region plays a critical role in Ghana's health system, and we are proud to partner with the Ghana Health Service to strengthen the networks of practice in this region. Through this project, we hope to support better collaboration among health facilities, improve service delivery, and ensure that women, children, and adolescents receive quality health services. I would like to express my sincere appreciation to the regional minister, the Ghana Health Service, and all partners for your leadership and commitment. Korea remains fully committed to working together with all of you to strengthen primary health care and improve health outcomes for communities across this region. Please remember, the Korean people are always with Ghanaian people, especially Ashanti people. Thank you.
Government Planning Officer and the rep of the Honorable Dr. Frank Amoakohene, the Honorable Regional Minister. Thank you.
Now, Chairman, I acknowledge all dignitaries and participants, including our friends of the media. I must first thank Nana Chairman singularly for an important thing that he has done in my life today. His dance moves refreshed my day. And if I review the health status of urban health status before the dance and that of the dance, I'm more healthier than before. And this is to say that whatever we are going to do in 2026, we must reflect his dance moves. And we must dance same with enthusiasm. Because as he was dancing, we're all thrilled. So let's make our people also be thrilled by the dance that we are going to dance in 2026. Now, my regional minister's speech. First and foremost, I must say thank you to the Regional Director of Health Service, Dr. Fred Adumakubatin, and the entire organizing team for this kind invitation. Annual reviews of this nature are not merely bureaucratic exercises. They are moments of honest reckoning, collective learning, and renewed commitment. To be invited to set the tone for such a gathering is both a privilege and a responsibility I do not take lightly. I am truly grateful, and I promise to be worthy of the trust placed in this office. On behalf of His Royal Majesty Otumfuo Osei-Tutu II, the Ashanti Hene, the Ashanti Regional Coordinating Council, and the ever-gracious people of Ashanti Mine, I extend a most hearty welcome to every participant gathered here today for the 2025 Annual Performance Review of the Ghana Health Service under the theme Primary Health Care, Closing Equity Gaps and Accelerating Universal Health Coverage. This theme could not be more timely, more bold, or more transformative in its implications. It speaks directly to the heart of what universal health coverage means in practice. That the first point of contact between a citizen and a health system, that is, the chief's compound, the health center, the polyclinic, must be accessible to all, free at the point of use, and of sufficient quality to make a difference. I am aware that Ghana's health sector medium-term development plan has consistently identified primary health care strengthening as the cornerstone of our universal health coverage journey. The evidence from around the world, and increasingly from within our own borders, confirms that countries that invest in strong primary health systems achieve better health outcomes at lowest cost with greater equity. This review, therefore, is not merely an assessment of past performance. It is a strategic checkpoint on Ghana's road to universal health coverage. And the Ashanti region must lead the way. The health of a region is the foundation of its development. No economy can thrive where its workforce is sick and unproductive. Ladies and gentlemen, permit me to walk you through the performance story of the Ashanti region over the past year. A story that is, like all honest stories, one of both pride and pain, of progress and persistent challenge. To fully appreciate where we are going, we must first understand where we have come from. Ghana's journey towards universal health coverage did not begin yesterday. It is a journey that stretches back decades. Rooted in the conviction that every Ghanaian, regardless of their station in life, deserves access to quality health care. A defining milestone in that journey came in 1999 when Ghana launched the Community Health Planning and Services Initiative, the CHIEFS program, a bold and visionary effort to bring healthcare out of the hospital and into the community to meet people where they live, where they farm, where they worship, and where they raise their children. 4 years later, in 2023, the establishment of the National Health Insurance Scheme marked another watershed moment, a recognition that no Ghanaian should be denied care simply because they cannot afford to pay for it at the time they need it most. These were landmark reforms, and we should be proud of them. They expanded access, they saved lives. They changed the relationship between the Ghanaian citizen and the health system, but we must also be honest. And honesty compels us to acknowledge that despite these gains, significant cracks remain in our foundation. Out-of-pocket payments still consume more than 1/3 of all health spending in Ghana, meaning that millions of families, particularly the poorest and most vulnerable, are still making the agonizing choice between seeking care and putting food on the table. Rural communities continue to face inequities in access that no amount of goodwill alone can bridge. And the rising tide of non-communicable diseases, hypertension, diabetes, cancers, is placing new and growing strains on a system that was built primarily to fight infectious diseases. It is against this backdrop, this rich history of progress and this honest reckoning with our gaps, that the government of Ghana has made one of the boldest health policy commitments of our generation: the introduction of quality-focused, free primary health care. This is not a political slogan, it is a policy covenant, a promise that made to every Ghanaian that the front door of our health system will be open to them, free of charge, and when they need it. Built on the solid financing architecture of the National Health Insurance Scheme and anchored in the principles of promotion, prevention, and early treatment, this reform has the potential to fundamentally reshape the health landscape of our nation, reducing the congestion in our hospitals, improving efficiency of our systems, and most importantly, delivering the equity in health outcomes that our people have long deserved and long been denied. Free primary health care is our most ambitious upstream intervention, yet it is a commitment to protect the source, to make the first point of contact between a citizen and the health system not a financial obstacle, but an open door. By removing the cost barrier, prioritizing prevention and early treatment, and strengthening the national health insurance as the financial engine, this policy gives us the best opportunity we have ever had to manage the river before it floods. I want to speak personally for a moment, not just as the regional minister, but as a son of this region, as someone who has seen with his own eyes what illness does to families, what maternal death does to communities, and what a dysfunctional health system does to the dignity of a people. When I assumed office, I made a personal commitment that health will not be an afterthought in the agenda of the Ashanti Regional Coordinating Council. It will not compete for the attention at the margins of our meetings. It will sit at the center of our development conversation. Because I believe that you cannot develop a region whose people are sick, whose mothers are dying in childbirth, whose children are stunted by malnutrition, and whose workforce is diminished by preventive diseases. Permit me to speak directly to what the Ashanti Regional Coordinating Council has done and is committed to continuing to do in support of the health sector in our region. First, on infrastructure and logistics. Second, on human resource development, deployment and welfare. Third, on community mobilization and demand creation, meant to be filled and demand creation. Fourth, on the free primary health agenda. The Regional Coordinating Council has fully embraced the government's commitment to free primary health care and has directed all MMDAs to align their health-related expenditures and community engagement programs with the implementation requirements of this landmark policy. We are committed to ensuring that every chief's compound, every health center, and every community in this region understands, trusts, and benefits from this transformative initiative. These are our commitments. They are backed by action, sustained by political will, and anchored in our unwavering belief that a healthy Ashanti region is our greatest development asset. The Ashanti Regional Coordinating Council, under my watch, will be a proactive, engaged, and accountable partner to the Ghana Health Service. I therefore challenge every MMDC in this region to match this commitment at the local level. Prioritize health in your budget, support your health directorates, engage your communities, and let the 2026 annual performance review be the occasion on which we can all stand here and say the political leadership of the Ashanti region kept its word to the people. That is the standard I'm setting, and I invite every one of you to hold me to it. Before I speak about what must improve, I want to first speak about what deserves appreciation. Because gratitude is not only good manners, it is good leadership. The financial ecosystem that sustains our regional health service is built on the contributions of many. The government of Ghana, through its annual health budget, provides the bedrock funding that keeps our facilities open, our staff paid, and our programs running. We are grateful. The National Health Insurance, despite its well-documented challenges, continues to be the single most important financial protection mechanism for the people of this region, reimbursing facilities for services rendered, improve our budget planning so that allocations reflect real priorities and real costs. Let us improve our expenditure tracking so that we always know in real time how much we have spent on what and with what result. Let us strengthen our internal audit system so that irregularities are caught early and corrected swiftly. And let us build a culture from the regional director down to the chief's compound where financial integrity is not the exception, but the expectation. The government of Ghana's budgetary commitment to health, the NHIA's reimbursement flows, the IDF generated by our hard-working facilities, and the generous investments of our development partners, that is World Health Organization, UNICEF, QUAICA, GIZ, JICA, the World Bank, UNFPA, and others, together constitute a significant pool of resources. The question is not whether we have enough resources to do, we always need more. The question is whether we are extracting maximum health value from the resources we already have. And I believe with the right systems, the right discipline, and the right leadership, we can do significantly better than we are currently doing. I therefore call today for a regional commitment to what I would describe as value for money health financing, a commitment that says every budget decision must be driven by evidence. Expenditure must be justified by impact. Every audit financing must be acted upon. So every audit finding must be acted upon, and every financial report must tell the true story of how public resources were used in the service of the public good. This is the standard that the free healthcare agenda demands of us. This is the standard the UHC requires. And this is the standard that 5 million people of the Ashanti region deserve. Ladies and gentlemen, behind every health statistic we have reviewed today, behind every maternal death averted, every child immunized, every epidemic contained, stands a human being in a uniform, often working long hours in difficult conditions, far from family and sometimes without the basic tools and support they need to do their job well. Our health workforce is our most valuable asset. And like every valuable asset, it must be properly deployed, adequately supported, continuously developed, and genuinely cared for. I must therefore speak frankly about the human resource situation in our region. Our staffing levels, while showing some improvement, remain below the threshold required to deliver quality care across all our facilities and all our communities. The geographical distribution of our workforce continues to reflect a persistent and troubling inequity, with doctors, nurses, and midwives concentrated in urban centers, particularly in and around Kumasi, while rural and peri-urban communities and districts such as Secretariat Front Plains, Amensia West, and Secretariat Central continue to operate with critical staffing deficits. The inequity is not merely a management problem, it is a justice problem, and it demands a justice response. I call on the Regional Directorate, in collaboration with the Ghana Health Service Headquarters, to accelerate the development and implementation of incentive frameworks that make rural postings not just bearable, but genuinely attractive, through housing support, hardship allowances, accelerated career progression, and the kind of professional recognition that tells a health worker posted to a remote community that their sacrifice is seen, valued, and rewarded. At the same time, I wish to commend most sincerely the significant investment that have been made in training and capacity build over the past year. From in-service training programs and clinical skills development workshops to mentorship schemes and the sponsorship of staff for further education. These initiatives are building the
Damasi away say yenya emre every year bia yenyina yeba together as a Ghana Health Service. Now Bruni say we take stock of a normal yaye enyina into say ena yebeye this network, this collaboration is to address the challenges that the region is having. And I'll state some of the challenges the region is having. The name of this collaboration is what we call the COICA RAMCA Network of Practice Projects. There are issues that we are facing. Basically, we are looking at 3 regions: Ashanti region, Eastern region, and Central region. And what these projects seek to do is to first of all address challenges when it comes to maternal and perinatal morbidity and then mortality. And how are they going to do this? And how are they going to support us? It has 3 main pillars. The first pillar that they are really going to look at is, if you look at the network of practice, that initially was the design. What they are going to do is that if you look at the CHIPS compound together with the health center, which is the hub, or for want of better word, the primary network, they are going to build capacity, the skills, the knowledge, and the right attitudes of midwife, general nurses within that primary care network. And one main way that they are going to do that is what we call the clinical mentorship. Look, if you look at the morbidities and mortalities that we have, together with the inequity of staff distribution per what we have seen, the issue is, how do you build the capacity of a midwife so that cases that they don't refer, they are managed at either a CHIPS compound or a health center, rather than referring all of them to, let's say, the district hospital. That is what this project seeks to do. We'll build their capacity so that they'll be able to manage that. And this is when people expertise at a higher level, whether they are from teaching hospital, whether they are the district hospital, they will be provided with the incentive to be able to go to this peripheral regions where we lack the capacity for them to build. Look, if you look at most of the issues that we are having is about mentorship. And this clinical mentorship is targeted, it's tailor-made. It's not like everybody is going to have. No, we look at the data where the challenges are coming, they have. And that's what the Korean government is going to help us to do. That's the first one. The second one that we are going to do is we are going to build the capacity of leadership and governance. And most of the time when we talk about leadership, people talk about the national, the regional, the district. No, the people where the midwife in charge of the maternity, she's a leader. And she is supposed to have some requisite expertise and competencies to be able to deliver the work that they do. Korean government is going to help us to do that. Building the leadership component at the CHIPS, at the health center, at the district hospital, in a framework of the primary care network or the network of practice. The third one that Korean government is going to help Ghana, Eastern region, Ashanti region, and then Central region to do is logistics and commodities. Look, if the woman is bleeding and you need medicine to give this woman to stop the bleeding, there is nothing that you can do. Or if you need some diagnostic equipment to be able to come up that, look, this problem that is being presented to us, this is what is causing that. If you cannot do that lab, then it means that you have a challenge. We know that we are doing our best. Korean government, through this network of practice or primary care health project, is going to support us in doing that. It's basically going to be about 4 years. And the best thing about this, when it comes to commodity logistics, they are going to help us to identify the things that we know we need. For this, they have subjected or sublet this to UNICEF, which is going to do that. So that is what we are going to do. It's about 4 to 5 years project. And for the best thing that this program is going to do is the accountability mechanism. It's not going to be like, no, we gave you this. We are going to tie all these performance with the results that we are going to generate. And this we are going to come as and when to really give stewardship of what we have been entrusted. We will stand on behalf of the Director General of Ghana Health Service, on behalf of, but before I thank the Korean government, we also know about the free primary health care that the government is championing. Basically, this will provide a vehicle to achieve that, because the intervention is basically at the primary level, where access will be given to all the population that need that kind of services. So we stand on behalf of the Director General of Ghana Health Service, the Minister of Health, and for that matter, Government of Ghana, to thank the Korean government for coming to support us. In our saying, they say that if you're having a load and you're carrying, and somebody is helping you to carry the load, you thank the person. So, so on behalf of Nana, we are going to allow Nana and then Lee, and then the rep for the regional minister to officially launch this network. So Nana, over to you and Alaji, please, and Lee.
Talk about the non-communicable diseases in the communities. You talk about supply chain and the maternal mortalities in the facilities, in the communities. I always talk about the maternal mortalities. As the medical superintendent from Kumpanach said, pregnant women, they are not sick. If they are not sick, why are they dying? They are not sick, but they are dying. Something must be done. Because the way manner our sisters, mothers, nieces are dying, something should be done. Do they delay them at the lower facilities? I'm talking at the periphery. Why? In the communities, some of these things are happening, but we don't say them because it is a taboo. When a pregnant woman dies, it is a bad news. We don't have to entertain it. What can we do as community leaders? We can also do something in the communities to support the work of the Ghana Health Service. Some of these deaths can be prevented. If you come to my community, as soon as I was installed, I was a chief, I had the pregnancy school. Because when I was in the then Ejusu-Jabin district, we had the Ejusu-Jabin loan scheme for the hard-to-reach areas in the Ashanti Bonfa sub-districts. So what I do is that time, there was no health facility in my community. There was a traditional birth attendant, which I said no. So all the pregnant women were registered. Then, that time, this control officer, every 3 months, had a meeting with them. It was called a pregnancy school. I did that, and I said, no, why don't I put up a small clinic? The community put up a clinic, and Dr. Aaron sent some nurses to the community. I have done this for the past 18 years. Every 3 months, all the pregnant women and the nursing mothers will come to the palace for a meeting. Then the midwives and the physician assistant come and health educate them. We can do that. All the traditional rulers can do something in our communities. Regional data talk about accommodation for the CHOs in the communities. You go to the hard-to-reach areas, you won't get a place for the CHO. Can't we do something for the
CHOs, the communities. We can do something. Back to my community, for the past 15 years, 6 nurses are staying in my house for free. They don't pay for anything. It's only electricity bill. They are still in my house as a community. Accommodation for the visitor assistant has been bought by the community. We are now constructing a ward for the health center. No funding from the central government. It's the community resources we are using. Then every month, they have to be motivated, the teachers and the nurses. For the past 18 years, every month, a teacher, that I was giving them a file, 1. But later I found out that no, if the teacher doesn't have a fridge, what will happen? So I decided to give them 5 kilos of rice. Every nurse, every teacher, ESMA, you get it. Then I will add a tin of mackerel. Every year, just to motivate the nurses. It's in Quantakase in Efijako Abre North. I don't know whether this data is here. Data Clement. Yes. Yes, yes, yes. Then we have more staff at Komfuanochi. The specialists, as the medical superintendent said, the region should liaise with them. Once a while, some of the specialists will be deployed to the periphery to help. If we are able to do that, I think maternal mortality will be reduced to the lowest level. I don't want to say so many things because you have already listened to the speakers. I once again thank you for giving me the audience, and I will thank you for helping me to break this program to a successful end. Thank you.